Good day everyone, I'm Dr. Athira Ramakrishnan. I'm Additional Director Head Neck Surgery at Krishna Institute of Medical Sciences, Bangalore. I also practice in Magna Center at BTM. So today the question asked to me is, why is the incidence of cancer increasing in younger people? Actually it is true that we are seeing the incidence is increasing, but we have to divide it into different categories and see why in each category. I am a head and neck surgeon, so I can talk about thyroid cancer and oral cancer. The thyroid cancer, we are seeing an increase in incidence partly because we are doing ultrasound more for other indications. It may not be to detect a cancer. We actually tend to do more investigations when the investigation is available. So an ultrasound neck is now routinely done when there is a lymph node which has been there for a longer time. Earlier, these investigations were not easily available. So nowadays, most practitioners, they advise an ultrasound if somebody has a lymph node which has been there for more than 10 to 15 days. And to evaluate a lymph node, we end up doing an ultrasound. And most of the time, thyroid tumors may not be symptomatic. So such incidentally found thyroid tumors we are finding. But when you have a symptom, that discovery is often in a different way. Patients usually in head and neck cancer, they come with or a mouth ulcer or a throat ulcer and then get evaluated. If any of these ulcers are present in your mouth or throat more than 10 to 15 days, you have to get it evaluated. Another thing, the reason for the increase in incidence is the habits. So generally, people have found, the cancer surgeons have found in colorectal cancer, it is increasing in younger people, partly because of the obesity increase, sedentary lifestyle and all. So these are not it's not like you have this, then you will definitely have cancer. These are multiple factors at different levels. There is no one smoking gun. So there are multiple factors affecting the individual's lifetime at different times can lead to this increased incidence. But in head and neck cancer, definitely thyroid incidence cancer is increased, but we have not found in any mortality rate. That means the people dying because of thyroid cancer has not increased in at least last 2 decades. That is not, despite we are increasingly detecting thyroid cancer, the people have not, there is no increase in the mortality. Death because of thyroid cancer has not increased. Another thing I would like to talk about, there is something called HPV related oral cancer. HPV stands for human papilloma virus. So it is HPV is a virus which is transmitted in human beings through sexual contact or direct contact, and HPV related oral cancer is usually transmitted through oral sex between partners. All HPV is not dangerous. There are certain types of HPV virus, the 16, 18, 31, 35, 33. These are the ones which, when repeatedly exposed, they can have the patient can have risk of developing cancer. Usually they were initially found in cancer of cervix in women, but we are increasingly finding oral cancer which is related to HPV. And this cancer is seen in younger people, sexually active people, and with no habits. Traditionally, oral cancer or pharyngeal cancer was seen with tobacco and alcohol exposure, but this particular HPV-related cancer is not related to tobacco and alcohol, and it is related to HPV exposure. So, multiple sexual partners is a risk factor for this kind of exposure. And the earlier onset of sexual activity is also a risk factor. So you have to know the safe sex practices which can protect you from this cancer. But this particular HPV-related cancer has a little less aggressive appearance than the traditional tobacco and alcohol-related cancer. But it's a cancer nonetheless, so you should protect yourself. And another one good news about this is, when you take an HPV vaccination, which is now very widely available, you can actually protect yourself from this cancer. We have this HPV vaccine now available, and usually given to young women, but males also can take it for protection against HPV.